Hi guys, my name is Asad and today I'll be summarizing the topic of hypertension. I know it's a very big topic, but I will try to cram as much information as I could in this video, and I hope you will like it and you will learn a lot from it. So basically, what is hypertension? Hypertension, you will declare hypertension if the systolic blood pressure and diastolic blood pressure for a long period of time is over 140 by 90. 140 millimeter of mercury systolic and or greater than that, or diastolic 90 millimeter of mercury and greater than that for a long period of time, you will call it hypertension. Now we have divided hypertension into 3 grades, and these grades differ like 20 per systolic and 10 per diastolic. You have grainward hypertension, that is 140 to 159, and that is systolic, and diastolic is 90 to 99. In grade 2, the systolic is 160 to 179 and diastolic is 100 to 109. And in grade 3, you will have systolic equal or greater than 180 and diastolic equal or greater than 110. Now moving forward to the causes of hypertension, what are the etiologies of the hypertension? So we have divided etiologies into like primary and secondary, and majority of the hypertension is unknown. Like primary hypertension occurs like 95% of the cases, and the onset is usually like age 25 to 55, and there is very significant family history there, but the mechanism is disputed, unknown, unclear. We don't know about the exact mechanism this develops. So let's move forward to the secondary hypertension. So in secondary hypertension, you will first consider that if the patient is less than 20 or greater than 50, or it's happened suddenly, there is no very great history of having of this patient, and it's severe. It's like not unlike primary, that is just increase 20 to 30. It maybe increase like 40, or systolic. I'm talking about systolic is decreased by 40, or it's very severe. You will consider it secondary hypertension. It's also refractory. Refractory, you can call it resistant hypertension. It means that it is not being controlled by any hypertensive. The hypertensive therapy failed on this patient. Causes are known. There are several causes for the secondary hypertension. So now I'll move to the main causes of your secondary hypertension. Now, what are the causes of secondary hypertension? The main cause are renal disorders. They are most common cause. Now, what are the main diseases that actually of renal, specifically of renal disorders? Which renal disorder specifically causes your secondary hypertension? So basically your glomerulonephritis, polycystic kidney, diabetes mellitus, renal artery stenosis, or polyarteritis nodosa. Now I have listed like the most common one here, but there are other renal disorders that contribute to secondary hypertension. Now, apart from the renal disorders, there are other disorders that significantly contribute to the secondary hypertension. There are disorders like endocrine disorders such as acromegaly, hyperthyroidism, Cushing syndrome, and your certain medication like oral contraceptives, steroid, NSAIDs, cyclosporin, etc. Also, polycythemia vera also causes your secondary hypertension. These are the main causes of secondary hypertension. So what are the complications of hypertension? It's have a very severe complications, severe neurologic and cardiac and vascular complication. Also, it's affect kidneys as well. So the main complication is your TIA, transient ischemic attack, stroke, ruptured aneurysm, congestive heart failure, coronary artery disease, left ventricular heart failure, renal failure, proteinuria, atrial fibrillation, and retinopathy. These are the main complications that are caused by your hypertension. So talking about the management, we have a goal set in mind, that what we want the condition of the patient after we will start the treatment or the management of the hypertension. So our goal will be that if a patient is normal, have not any other disease apart from the blood pressure, not any significant disease apart from the blood pressure, the increased blood pressure, that is hypertension, you will have a goal that you decrease the blood pressure to 140/90. And if the patient is suffering from diabetes mellitus or renal failure, you will try to decrease his or her blood pressure less than 130/80. Now, the first the thing in the management is your lifestyle modification, because lifestyle contributes a lot in hypertension. Like BMI, increased BMI suggests that you have a large amount of fat in your body, and fat you produce what? Adipokines, and adipokines act on vessels, increase blood pressure. So you will try to get the blood pressure BMI normal. And also aerobic exercise, a very helpful thing for like 30 minutes 5 to 6 day a week. Low fat, low sodium, and obviously decreasing the alcohol, because it has a lot of different effects effects on your blood pressure. Now, if lifestyle modification doesn't work for a long period of time, you can go towards the pharmacologic treatments, and you will do pharmacologic treatments under 3 conditions. And these 3 conditions are: if the blood pressure is over 160/100, or only the systolic, even the only systolic is above 160. Also, if the patient has any other disease such as transient ischemic attack, nephropathy or retinopathy, or you will even try to give pharmacologic treatment even if the blood pressure is just above 140/90. Now, moving forward, the drugs that are used for hypertension. So these are the list of drugs that are used for hypertension, and in the bracket I have listed things in which they are given. For example, if someone is suffering from uncomplicated hypertension, diuretic is the best option you can do, your thiazide diuretics. And if the patient is suffering from like congestive heart failure, the beta blockers are the good choice. ACE inhibitors, if your patient is suffering from kidney disorders, and angiotensin receptor blockers if the patient is suffering from diabetes mellitus. And if the patient is a patient of angina, you will give a calcium channel blocker and alpha blockers for BPH. Methyl-dopa and central agonists are also used. Now, basically, what the management is like, we go stepwise. First step, if the patient is like, these steps are used like this, that if the first step fails, then we'll move to second step. Then second step fails, you move to third step. And if even the third step fails, you will treat it as resistant hypertensive patient. Now, the first step is that if the patient is greater than 55, if the patient is less than 55, or diabetes mellitus 2 patient, you will give ACE inhibitors to treat the hypertension. And if the patient is greater than 55 or from African or Caribbean descent, you will give diuretics along with calcium channel blocker. If this fails, move to the second step, that is, you will give diuretic with calcium channel blocker to the less than 55 patient, and for the patient that is above 55, you will give ACE inhibitors, your angiotensin receptor blockers, diuretics, or specifically your thiazide diuretics. Now, for the step 3, if the second step fails, you will go toward the step 3, and in the step 3 you will give ACE inhibitors and angiotensin receptor blocker, calcium channel blocker, and diuretic. You have a choice between ACE inhibitors or angiotensin receptor blocker. If the step 3 fails, you will treat it as resistant hypertensive patient. And I'm going to talk about resistant hypertensive patient in another video. So this is the main summary of your hypertension topic. I hope you liked it. I hope it summarized the topic, and I hope you learned a lot about hypertension today. So thanks for watching, and if you like these kind of videos, please subscribe and share with your friends. Again, thanks for watching. Any suggestion, any comments, or anything I get wrong in this lecture, please comment down below. Your suggestions are highly appreciated. Bye for now.